Okay, thank you to everybody again who has joined us this evening. I hope you are all doing well and are healthy and are breathing clearly with all this wildfire smoke here. We know it's been really busy recently for everyone, and it's been a really hard couple weeks and couple 6 months. So thank you for taking time out of your schedule to join us this evening. We are about 10 minutes into, past time already, so we're going to make this pretty brief. I'd like to introduce our panelists this evening. And then, as I said just a few minutes ago, for those of you that were logged in, we're going to try and hold Q&A until the end of tonight's session. So before we get started, please familiarize yourself with your Zoom screen. You should have 3 buttons down at the bottom of your screen. There's a chat button, a raise your hand button, and a Q&A button. For questions for the panelists, please submit those via chat or raising your hand. We'll be happy to help you. And if you have specific questions that you're hoping to get answered or something that comes up during the webinar itself, please click on the Q&A button and type your question in there. We will be getting to those a little bit later in tonight's session. So without further ado, I'd like to introduce our panelist for this evening. Her name is Victoria Starr. She's a registered pharmacist with 25 years of experience. She has 8 years combined experience working as a pharmaceutical sales representative with Eli Lilly and Company and with Johnson & Johnson, promoting and educating mental health professionals on psychotropic medications. After leaving Big Pharma, Victoria became partners in ProStar LLC, creating employer-owned pharmacy operations for large employer groups. Throughout these years, she was also the pharmacist in charge for the Monacare Pharmacy at Monaco Coach, spending her time caring for patients and creating disease state management initiatives. During this time, she built pharmacy operations for Slocum Clinic in Eugene, Oregon, and for Monaco Coach in Indiana. So Victoria is originally from Eugene. However, recently she has lived in Portland and just a couple weeks ago moved down to California. So we are thrilled to have her with us here this evening. She is incredibly knowledgeable. I've personally heard her speak already, and she is fantastic. So I think everyone is going to get a really fantastic webinar tonight. So without further ado, I'm going to turn it over to you, Victoria.
Hey. There we go. Sorry, I just have to get it on the right thing here. There we go. There we go. Okay, so tonight I would like to talk to you about cannabis and how one plant can treat a myriad of cancer symptoms. This is an integrative approach to treating cancer. First, I'd like to talk a little bit about how I ended up in the cannabis space. I am a pharmacist with 25 years as a board certified pharmacist. I discovered medical cannabis after coming down with Lyme disease and battling breast cancer. And I'm currently adjunct faculty at Washington State University College of Pharmacy. I'm also pursuing a Master of Science in medical cannabis at the University of Maryland College of Pharmacy. But I wanted to talk about how a Western trained pharmacist ends up getting into the cannabis market. And basically it started with my health. And I've always been a very healthy person and active, and had a series of different health problems that created many difficulties for me. And it first started with Lyme disease, and then it moved on to breast cancer. And it's actually my experience in using cannabis with my breast cancer treatment where I was really able to see the many benefits that cannabis had. And I realized that it can be many medicines and it's just one plant. And I'd like to explain to you how one plant can treat so many different things. And I know people will often say that it seems like unreal, it seems too good to be true, but there's actually a very, some very compelling and science-based reasons at why cannabis works this way. So what I like to tell people about medical cannabis and cancer is that medical cannabis can help patients achieve relief from cancer-related symptoms in treatment. It is the single medicine that can decrease nausea and vomiting, enhance appetite, and decrease pain and improve mood and sleep. So cannabis has a long history of being a medicine. Started 3,000 years ago, and people have been using it all over the world to treat all kinds of things. The picture that I have here on the left is actually some parts of the cannabis plant. They're called terpenes. Caryophyllene is a terpene that's found in cannabis. And this was a picture that I took at a pharmacy museum in Germany this last winter. So there's components of the plant that's been used all throughout civilization. And only recently in the last 100 years has there been a movement to criminalize it and to make it into an illicit substance. So without getting too deep into that, we'll remind everybody that cannabis is legal in the state of Oregon to use both recreationally and as medicine. And to date, federally, it is considered an illegal Schedule I substance. Unfortunately, the U.S. Food and Drug Administration still does not approve it as an actual medicine, and it certainly, at this point, is not approved as a treatment for cancer. So let's talk a little bit about why medical cannabis works. And part of the reason, or the number one reason that it works, is because our bodies are actually equipped with a system called the endocannabinoid system. And your body has the system that is ready to receive what we call cannabinoids that will keep things in homeostasis for your body. It keeps your body balanced. Your body actually produces its own cannabinoids. We call them endocannabinoids. And then cannabis is made up of about 100 what we call phytocannabinoids. Phyto meaning plant. So in the cannabis plant, there are 100 or more cannabinoids that will work on this endocannabinoid system that's in your body. And I'll start with the most common examples of cannabinoids, which are THC and CBD. THC is a cannabinoid that interacts with specific receptors in the brain. And this is the cannabinoid that is responsible for producing the high that many people associate with cannabis. But THC also reacts with other receptors that are found on other tissues and on immune cells. So it has other features and other benefits besides the illicit response that a lot of people will associate with it. CBD, which is really hot on the press right now, is another cannabinoid. And CBD interacts with other receptors that are much different than the THC, where THC works. And CBD can help regulate the endocannabinoid system, keeping things in balance, and it has no mind-altering effect. Cannabinoids have benefits, and we know this, and actually the FDA would even say so, because there are currently medications that are approved by the FDA that either mimic or are synthetic cannabinoids, and that's Marinol, which is an FDA-approved prescription. It is a synthetic cannabinoid, and that is used oftentimes in cancer treatment. And it's been used for many years. So we know that these medicines work as evidence of the FDA approving a drug that's just basically synthetic THC. So I want to talk about the potential benefits of medicinal cannabis. And when I say cannabis, I truly mean not hemp, which is a different strain or a different variant of the same plant. I'm talking about cannabis, the illicit cannabis that you think of that's in a dispensary. So these are the potential benefits. It is been proven to be a potent anti-nausea medication, appetite stimulation. It's been proven to have pain relief benefit and is really good for radiation burn relief. It's good for anxiety and for sleep. And there are some studies that are showing that there are possibly anti-tumor effects that are related to cannabis. And this has been demonstrated in a variety of different cancers. And I'll talk about each of these in the next about half hour. So let's talk about cannabis as medicine. Let's forget about cannabis as the illicit drug that we associate with college students and with the 60s, with the hippie movement. I'd like to talk to you about medical cannabis. And then probably the most important thing for you to know about using cannabis as medicine is that you can use it without getting high. And that's actually something that's really important to me when I'm working with patients. When I created my consulting company where I help patients navigate through figuring out how they can use cannabis as medicine, that's one of the first things I really want to tell people, that regardless of what their experience has been or has not been with cannabis, I want them to feel comfortable. And the goal is not to get high. The goal is to get relief. And that most time that I'm working with someone, we can offer relief without any worry or concern of getting any mind-altering effects. So the THC that is in cannabis, the cannabinoid that's in cannabis that we think of as psychoactive, mind-altering, I tend to use that in very small amounts when I'm dealing with patients. And I use it in combination with CBD, which is not mind-altering. And actually the CBD, when it's used with THC, it will cancel out or block the high of the THC, which is really nice. So we use these two cannabinoids together and they work very well together. When I use THC with CBD, I don't need to use a high amount of CBD. I tend to be able to use a smaller amount. They synergize each other. So basically, when they're used together, their benefits are amplified. The problem is that cannabis is, there's no dosing standardization. You think about how often people will go to a dispensary and there's multiple different strains which are very different and have varying amounts of cannabis, or excuse me, of CBD, varying amounts of THC. And so there's a lack of dosing standardization when we're talking about cannabis. Because of its legal status, it's very hard, right? Hard to get any testing or any studies done on it. So there is complexities in using it as medicine, as opposed to going to your medicine cabinet and grabbing a bottle of Advil, which has got 200 milligrams of ibuprofen. When you are obtaining medical cannabis, especially in the flower form, where you would see it in the dispensary, it's going to be composed of many different constituents. So what I tell people is that one plant has not only the over 100 cannabinoids, but it also is full of terpenes, which are the pungent and what gives the cannabis its scent and flavor, and flavonoids. And there's all kinds of other naturally occurring elements that are in that plant that in different ratios and in different doses, each thing is going to create its own medicine. And the complexities of dosing go beyond the plant. So when I'm working with somebody and trying to develop a recommendation on how they should be using cannabis to treat their symptoms, I look at what their experience has been in the past, whether they've used cannabis before. Oftentimes I've got older folks that have never used cannabis. They're really scared. So for those people, I'm always going to start on a super low dose, get them very comfortable with the thought of using this medication. With somebody that's got a little bit more experience, especially if they're very sick, we might bump the dose up a little bit quicker. We all have genetic differences on how we our bodies are able to metabolize these products. So sometimes, depending on what's going on, I might even do a DNA test to see if their body has any issues with the metabolizing THC or CBD. And then each of us has our own endocannabinoid tone. Each of our endocannabinoid systems are going to have their own needs. Each of us has very different healthcare concerns. If somebody comes to me and they have multiple immune problems, they've got Hashimoto's, if they've got lupus, if they've got multiple autoimmune conditions, their endocannabinoid tone is completely different from a healthy young 20-year-old that might just have some anxiety going on. I also look at the patient's age. Sometimes I have younger patients, sometimes I've got older patients. Older patients metabolize things differently or have problems with their kidneys or with their liver. And so there's going to be dosing modifications for those people. And young children are not small adults. They completely have a different way of processing the medication, and we need to keep these things in mind. I also look at drug interactions because oftentimes these cannabinoids can interfere and interact with different medications that people might be on. So a patient-centric approach is key, and especially when I've got somebody that comes to me and they've got cancer. So let's talk about the benefits and how cannabis can be beneficial. So the anti-nausea effects of THC have been demonstrated in many studies. It's proposed that THC stimulates receptors in the brain and in your GI tract to reduce nausea and vomiting. So it works in a couple different areas to decrease those symptoms. CBD works a little bit differently. It reduces the stimulation of the vomiting center through our serotonin receptors in the brain. And then there's another cannabinoid that's getting a little bit more attention, and I have used this a few times. It's called CBDA. It's also a non-mind-altering cannabinoid. It is seen as being much more effective than CBD in reducing anticipatory vomiting. So, and also the nausea. And where I would tend to use this is if somebody is getting anxious and nauseous just thinking about going to their chemotherapy, this is something that we could use ahead of time to help reduce some of that anticipatory nausea or vomiting that might happen. We use that with a little bit of THC, and hopefully just use a small enough dose that a person wouldn't feel the effects of that. So the dosing for these different agents, it varies. It depends on what the cause of the nausea is. Is it from anxiety? Is it from the chemotherapy itself? Is it, you know, what is going on with the patient? How bad is it? So we need to do a whole assessment on a scale of 0 to 10, you know, how bad is this? How often are you vomiting? So I do a whole assessment to figure out how to dose these different components. In appetite stimulation, THC and THCA, which is also another non-psychotropic cannabinoid, both of these have a stimulatory effect on appetite and can help increase food intake. So if I've got someone who just needs to gain weight, who's just not necessarily nauseous, but has lost their appetite and is losing weight, and we need to get some more calories in them, we can use these cannabinoids. THC activates receptors in the brain that enhance food pleasure and help food sound more palatable. Sometimes we do have to use a little bit higher doses of this to get this to work. But generally, if someone's losing a lot of weight and they've been comfortable using cannabis already for other things, they get more comfortable with the fact that maybe they would have some mind-altering effect, and we'll try to do it in the evening so that it will benefit them in terms of getting them a better night's sleep as well. CBD for pain. So CBD reduces inflammation by modifying, working with chemicals that produce inflammation. And it regulates pain at the spinal cord. It also suppresses pain, both neuropathically and inflammatory pain. So it's important. We're talking about pain. Oftentimes, I know that patients will go into a dispensary or ask a question about whether they can use cannabis or CBD for pain. And yes, both, all the cannabis is very good for pain, but probably the more important question is, what is the pain coming from? What type of pain are we having? Are we talking about bone pain from metastatic cancer? Are we talking about inflammatory pain from arthritic pain? Where is the pain coming from, and what's the best way to target it? I generally recommend a full spectrum oil for any type of pain, and different combinations of THC and CBD with the together, a 4-to-1 ratio of CBD to THC for a neuropathic pain, a 10-to-1 for someone that's maybe a little bit more sensitive, and I'm worried that they're older and that they might get some mind-altering effect from THC. A 20-to-1 is also a good ratio. I start with some of these ratios. It just varies on what the pain is, where their pain is rated, and how old the patient is. But these are some of the ratios that I might look at when treating pain. And THC is a great pain reliever as well. It relieves central pain. It works through multiple neurotransmitter systems. It's also a potent anti-inflammatory. There was a study that showed that kind of a high dose of THC was shown to have really good pain relieving effects, and compared it to 60 or 120 milligrams of codeine, which is pretty surprising. But that dose is high, and that's not something that I would start a patient off on, but it just gives you an idea of what the doses might be for more substantial pain. I generally use, like I say, a full spectrum oil in combination with other cannabinoids, depending on the pain. And oftentimes we'll use these ratios with other pain medicine. And I'll talk a little bit about that, some ways that you can use cannabis with the pain medication that's already on board, and why it is safe to use with other pain medicine that your doctor might prescribe. Radiation burns was something that I used cannabis for, and it was amazing, actually, my results that I had. It has anti-inflammatory and pain relieving properties, and all of these properties relate to the skin. We've got receptors for the cannabinoids in our skin, and it can definitely help with pain and inflammation. So just adding a full drops of a full spectrum high CBD cannabis oil to whatever your doctor is recommending for your skin regimen works really well. I used it twice a day, and it really relieved the burning, and it helped my skin really clear up and heal really, really fast. So I highly recommend that. And then cannabis with opioids. So cannabinoids have been demonstrated to have a synergistic pain relieving property when used together. So you can use them. I don't tend to dose them at the same time. They work through different receptors, so there's not the risk of an overdose, but certainly both cannabis and opioids can create drowsy sedation as a side effect. So I tend to dose 2 hours away from opioids to avoid any additive drowsiness. Oftentimes when I add a combination of some sort of cannabis combination to a pain regimen, I'll do it at the same time, or have it take the place of a PRN medicine, a medicine that a patient is using as needed, and have them substitute the cannabis and just take it 2 hours away from their regular pain medicine, and I've seen patients drop their pain medicine by a half when we do this. So it is very beneficial. It can take some time to get to the right dose. And oftentimes, I just tell people to just keep following up with me, and we just slowly work our way up to it. And once we find that sweet spot, it's amazing. And then anxiety and sleep. I know that oftentimes, once we get the diagnosis of having cancer, when I was diagnosed with breast cancer, that every night I would try to fall asleep. And once I did fall asleep, I would still wake up in the middle of the night with searing anxiety, thinking about my diagnosis and what would this mean for me? What's going to happen? Do I have to take chemo? There's so many different stressors that are going on when you're getting treated for cancer. So the endocannabinoid system is believed to be involved with the regulation of mood and the anti-anxiety properties of cannabinoids. They work through serotonin receptors. I start really low with any cannabinoid. I usually start at like 2.5 milligrams. For CBD, it's really important to start low. I don't believe in a one-size-fits-all approach. I know oftentimes people will see a CBD product on TV or online, and they'll have like a set 10 or 20 milligram dose, and more with CBD is not better. I urge people to start at a very small dose, 2.5 milligrams, and work your way up to your desired effect, maybe even every couple days, depending on what you're using it for. CBD is a lot different than other medicine. And once you hit the effective dose, if you go too high, if you continue bumping the dose up, it stops working. So what I tell people is if you were working your way up and it was working, and you hit a dose and it stops working, back the dose down another 2.5 milligrams and see if you get the benefit again. More is definitely not better with CBD. THC causes sedation through the interaction with the receptors in the brain, so it can be beneficial in small quantities. Worked with CBD for anxiety. When we're using it for sleep, I generally do a 1-to-1 ratio of start with 2.5 milligrams of CBD and THC and see if that works. I generally don't go higher than 5 milligrams, especially for my newbies. There is another cannabinoid that has been really beneficial. It's called CBN. I don't know if there's any products actually in Oregon that contain it. You might see it though on the shelf at some point. This is another cannabinoid that's really helpful for insomnia, and I'll use that as a 1-to-1 ratio with THC. Again, I start with really low milligrams, start at like 2.5 milligrams of each, and slowly work my way up from there. And I'd like to talk a little bit about the anti-tumor effects. And I know that I get a lot of phone calls and I get a lot of inquiries of people that want to treat their cancer with cannabis because they think that they're going to cure their cancer. And there are some studies that show that cannabis is beneficial for some reduction of some tumors, but it's very complex and emerging science. There's so many studies that show there's benefits, but they're inconsistent on the dose. They're inconsistent in terms of what cancers are being treated, on what cannabinoids are being used. So the anti-tumor effects appear to be very, very dependent on the type of cancer, its pathology, and then what cannabinoids and doses of cannabinoids and ratios of cannabinoids that are used. So I really have a struggle with giving people information on this emerging science. It's just too new. And so I generally avoid advising patients on these types of regimens. That being said, if somebody is very sick with a dire prognosis, and their oncologist has given them the heads up to pursue, I would be happy to do research and look into what information is available, but it's very much a gamble. And although I don't think it's unsafe, I just don't like people spending a lot of money and getting a lot of hope in something. So it would be a very particular patient that I would do these regimens for. And these are some important considerations that anyone with cancer that is going to start incorporating cannabis into their regimen should consider. I really think it's important to communicate with your doctors if you choose to integrate it into your cancer protocols. There are some doctors, some oncologists that say that there might be some issues with certain immunotherapies and using high CBD products. The information is very inconsistent, but I like the doctors to know what's going on and have some say and what should be happening in patients' care. So you're definitely communicating with the oncologist and the radiologist and letting them know what you're going to take. The dosage forms are vital to the efficacy of using cannabis in cancer protocol. I sway away from using edibles, from using cookies and candies and that type of thing. Most of the studies show that it's hard to get homogeneous products, meaning products that are consistent in those dosage forms. Also, sometimes they're harder to figure out a dose. If you have to cut things in half or quarter them, it makes it difficult. I tend to go with full spectrum oils from trusted sources. I've got a handful of dispensaries that I recommend that have good products that I recommend. When I put a protocol together, I actually will put the specific medication that I would like you to use. I put very specific dosing instructions. I try to use products that are organic and GMP certified and have certificates of analysis when necessary or when available. It's very hard to find really good products for medical patients. And so my goal when I'm working with patients is to take that legwork away from my clients and take care of that for them and source it for them. But oftentimes people will try to look for their own products. So these are some of the things you should consider. I also want to make sure that whatever product somebody gets, whether it's something in the dispensary or something that somebody is buying online, make sure that the label is clearly marked with the total cannabinoid content and with the dose per serving. You want to make sure that it doesn't say one serving is equal to a dropper full, but then it doesn't have what the dose is. Because we need to treat cannabis just like any other medication. I want my patients to know what dose of THC they need, what dose of CBD they need, what is working for them, how often they take it, just like any other medication. And I know I said about ibuprofen in the past, but ibuprofen, people know they take one ibuprofen, it's 200 milligrams. When somebody is taking cannabis as medicine, I want them to be very comfortable in being able to express to their doctor or to their pharmacist, I take cannabis for pain. This is my dose. This is the medicine I take, just like any other medicine. We need to start looking at it like that. And then I can't specify more or comment on this enough. Start low, go slow. Document your dose. Document the effect. Be sure that you have a notebook and you can keep track of what you're using and how it works for you. And you can always go back to that notebook and say, oh, wait a minute, did I take that today? Did that work for me today? Is my pain going up? Is something not working like it was before? So it's something that takes time. It's not an easy medicine, but there is an app that's available for people. It's called the Relief app, and that's another way if people are technology savvy, they can start using a tool like that instead of a notebook to keep track of what works. And then, storing the cannabis safely in a lockbox. I'm saying this more and more because we're starting to see that kids are getting into mom and dad's medicine, because we forget that this stuff can be very potent for children. So let's treat it just like we would any other prescription medicine. Keep it out of children's hands in a safe place. If children get into this, it can be pretty concerning. There's a lot of calls to poison centers when kids get into cannabis products. So please, if you do choose to use cannabis as medicine, keep it locked up and keep it safe. And with that, I can open up to questions.
All right, that's fantastic. Thank you, Victoria. All right, so we're going to open up Q&A now. I know everybody has a lot of questions, so we've already had a few come in. The first question is from a participant that says, when you're talking about doses, for example, 2.5 milligrams, is this flour?
No. So when I'm talking about, when I put up somebody on a cannabis protocol, I don't ever use strains or flour. And the reason I don't is because if somebody, and I think it works, I know it works, but the hard thing about using flour as medicine is that although it works very quickly and you get a quick response, we don't know what the dose is, and I don't know how to measure that. So there are a couple vape pens, they're vaporized pens that people have that say that they can tell how many milligrams you get per puff, but it really varies because each of us will inhale it to a higher degree. We're going to take a deeper breath, a less deep breath, hold it in longer, hold it in shorter. So it's very hard for me as a pharmacist who's, really trying to turn this medicine into medicine to create a protocol for somebody in that manner. So when I'm talking about milligrams, 2.5 milligrams, I'm generally talking about an oil or a tincture that can be easily drawn up in a dosage form and given to a patient just like any other medication.
Thank you for clarifying that. Thank you for that information. Okay, so the next question you already answered as well, which is what about flavored oil pens? I think that.
Yeah, I mean, there certain people, if somebody, I know there's many people that have used cannabis as medicine and are very comfortable with it, and they know their bodies and they know it works. For those folks, these things are probably really good for them. But for someone who's brand new coming into this, who most people don't want to smoke it that are coming to me, most people are cannabis naive. Those are the people that I'm going to be leaning towards an oral, a sublingual tincture under the tongue, or some sort of oil that they can use instead of smoking it.
Fantastic, thank you.
But it does work. It certainly does.
Okay. Okay. So now is a good time to go ahead and type those questions in the Q&A box. So whether you're on your phone or you're on an iPad, you might see the buttons up at the top of your screen if you're on an iPad or other device. But there should be a button that says Q&A. So we'd like for you to type your questions into those boxes. Okay, if you're having difficulty doing that, just raise your hand. So we did have a question that just came in and says, oh, this is a common one. What is Rick Simpson oil?
So Rick Simpson oil is a proprietary way of extracting or creating oil from flower, and it is generally high in THC. And it is, I think that Rick Simpson has put together information and gives people information on how to make their own, but it has turned into a kind of a generic term that many companies are using. So I see it oftentimes in a dispensary, and they'll say it's RSO. I don't know if it is or not, but it is generally a high concentrated THC oil made from flower, and it people have read about it being good for cancer. I've not personally used Rick Simpson's oil on anybody with cancer. I use sometimes a high CBD oil that's made the same way, but it's generally really high in CBD and not very high in THC. I hope that answers the question.
I think that was a good response. So the next question is, can CBD oil be used to reduce discomfort from radiation that was administered 3 years ago that is still numb and painful?
You know, when I hear people having radiation issues later down the road, I think that I wouldn't be using it topically. I would be looking to using it as an oral oil under the tongue, because it would probably affected their nerves, is what I'm thinking. I would have to do a full assessment, but I'm assuming there's some nerve damage from the radiation, and high CBD oil with a little bit of THC might be helpful. Starting with like a 4-to-1 ratio. So starting with like, just a small amount of CBD and that you could start with, and just a touch of THC, and working that in, increasing it every 3 days or so, and seeing whether that works. I mean, it's kind of hard to say. Sometimes I'll have to increase the ratio a little bit with people, but it's definitely worth a shot to get that CBD in there and help with the pain.
So the next question came in from someone who wants to know, what are some good dispensaries in Eugene? Are there any that you would feel comfortable recommending?
I send people to Moss Crossings over on Friendly Street. They've got good reviews. They've got products that I tend to recommend. That's where I've sent people. That's the only place that I've actually recommended in Eugene.
Okay. Thank you for that. Okay. Do we have any other questions out there? If you do have a question, you can type that into the Q&A box. If you're having trouble figuring out how to do that, just raise your hand and we can help you, or we can unmute you so that you can ask your question using your microphone. Okay, so it looks like we have another question, which is, do you consult with hospice or palliative care programs?
I have not, but I'm very interested in doing that. I would be honored to help out with stuff like that. So I'm very comfortable with those types of protocols.
Okay. Well, and that segues really nicely into the next question, which is, what does an appointment look like with you?
So what I do is, when somebody goes onto my website and they register for an appointment, they have all of their intake forms there online, which asks a series of questions about their experience with cannabis, about any problems they've had with it in the past, or whether they've never used it. Then that helps me figure out how to treat them. I do a pain, like if it's for pain, I do a pain assessment. If it's for anxiety, we do an anxiety assessment. But basically, we have all of the medical information that they fill out online, and then I call them up and have that information and look at it the day before and put together what I think would be a good protocol for them. But we have about a half-hour consult. I don't put a timer on. Sometimes we're over, sometimes it's longer, sometimes it's shorter, depending on what the patient's need is. But we'll go through all the different things that they have. So for instance, oftentimes I get a patient that comes in and they've got cancer. Well, they have problem with sleep, anxiety, with pain, with radiation burns. So we will go through a protocol, very specific medicine protocol for each of those problems. And I will look at their medication list, make sure that there's no drug interactions. I'll put together a dosing schedule. I'll put together what product they're going to buy, where they're going to buy it, how they're going to dose it, how they're going to increase it, what side effects to expect, everything. Oftentimes, I'll add some other pharmacy knowledge that I have. If I think that there might be something else underlying. I mean, one time I had a client that called me up that had horrible anxiety, some stuff going on with just out of the blue, horrible anxiety and depression. And it turned out he had been bitten by a tick. He had a bullseye rash. I mean, he had Lyme disease and nobody had caught it. And so we sent him off to the doctor to get tested for Lyme disease. So it's kind of nice for me to get a really good picture of what's going on and create a very patient-focused approach, and everyone gets a very individualized protocol. And then they get basically they can email me if there's problem, or they can send me any information and I'll get back to them. But if they want another consultation, they get a 15-minute consultation on top of that whenever they want.
Fantastic. So a couple of people have asked about your website and contact information, so we will be sharing that as well. We do have a question about, what about cannabis suppositories?
Yeah, this is a really good question. So when, after I was using cannabis for cancer, I saw a doctor in Portland, and she prescribed me cannabis, and I couldn't tolerate it. I was taking it hoping for a tumor reduction strategy, and you usually need higher doses for that, and I couldn't tolerate it. And so I looked into doing the suppositories, and I do have a very dear friend who has brain cancer, and she has been using them for years. I don't know if that's what's been keeping her. She's with us. She's been around for a while. God bless her. She's been fighting this for so long. But some of the data is conflicting. So part of the problem is how high the suppository goes up. And sometimes people get it up too far. Sometimes people don't put it too close, they don't move it in the right spot. So that will alter how it's absorbed. But the idea is that you can take a higher amount of cannabis and not get high, because it's not going to be going through your GI system and converting over, being metabolized into its active form. So the idea of being able to get large amounts of cannabinoids in your body is actually a good thing, and without getting high. So I think there still needs to be some more research and studies being done. I'm still waiting to get better information. I'm getting my master's right now in medical cannabis, and that's something that I'm hoping they'll explore this year. But if somebody needs help with that, and as long as their oncologist is okay with it, I can help govern and help them figure out how to make those and how to use those.
Thank you for that. So we have another question. Let's see, I'm going to skip out of order here. So we do have a question from a participant that says that they did not think that a pharmacist can prescribe medicine. How is cannabis different?
Well, the deal is it's not considered a prescription, first of all. Cannabis is not a prescription. So I'm not prescribing anything, I'm making a recommendation. And pharmacists can make recommendations on medication that's not prescription. So that's I guess the easy way to say it.
Okay. If the individual who asked that question has a follow-up, we'll be happy to answer that one as well. Okay, so now we have a question is, What about pain management for individuals who have had treatment but are still experiencing chemo pain in joints?
Oh yeah. I mean, the question is that can we help with that? Yes, definitely.
Yes.
And
Yes.
the
Okay.
that is that you can use, topical stuff first. So when someone has joint pain in particular, I would start with a topical product first before I eat, and that's so easy. You don't have to worry about drug interactions. You don't have to worry about any mind altering effects. So that's an easy spot an easy way to start and figure out whether that works or not.
Okay. Fantastic. Um, we actually have a follow-up question to the one that you just answered about suppositories, and I think that you may have inadvertently answered this. But the individual asked, were you referring to rectal or vaginal suppositories?
Oh, rectal. But the vaginal suppositories I've heard, um, I've got some good information on. I've heard some. There is a company that makes them for the vaginal ones for really severe cramps and for um, endometriosis pain. I recommended them for someone and never really heard back whether they worked or not. But I think that the data for the vaginal suppositories is probably a little bit better than for the rectal.
Okay. The next question is that this participant has heard that juicing cannabis leaves to get THCA, and is that a good wellness supplement? And is this a thing?
It is. It is. The raw plant, and I've tried it before, it's really hard to get a lot of juice out of it, and it's very pungent. It's very potent. If you juice the leaves, and you don't even need that many because there's so much in like a few leaves. I think that I read like 5 leaves that you could add that to whatever you're juicing and get enough in there, but it would just give you a few drops of that. But THCA and CBDA, so both the acidic forms of those cannabinoids, they're not going to make you high, and they're supposed to be fantastic for anti-inflammatory benefits. And I mean, we're going to learn so much more about these as medicine, definitely.
Fantastic. Thank you. Okay. All right. With the exception of contact information, we've exhausted all the questions right now. So if you have additional questions, keep those coming. Victoria, do you want to share your website real quick and
Oh, it's
good contact information for you?
Sage, SAGE, life, LIFE .care.
Oh, that's a new one. I haven't heard the .care before. All right. So I'm actually going to put that in the chat for everybody's benefit.
Perfect.
Okay. So I just sent that website information to all participants. So we have another question that just came up. What about GBG and CBD together?
CBG?
Well, it may be a typo, but this says GBG.
CBG, I'm thinking that they're saying CBG and what?
CBD.
Well, like what are they wanting to treat?
This might be a good one to open up the the microphone for. So bear with me for just 1 second. Okay. Okay, the participant that asked the question about the two together, your microphone has been unmuted if you'd like to ask that question.
David.
Hi, Victoria. This is David in Vancouver. So there's a lot of hybridization that's going on with the hemp growers, CBD growers, adding CBG, sorry for the typo, to the product because of its anti-inflammatory and have you heard other things related to cancer as
Yes.
well with the CBG product? And is there some kind of synergistic or beneficial effect of having increasing the CBG profile
Yeah.
to CBD. Yeah.
So CBG is definitely a cannabinoid that I do look for if somebody is really looking for a tumor regression. There's been some good studies of CBG and CBC. So those are two different cannabinoids. I don't really find a lot of products with them that show that in them. So I'd be interested in seeing what products are going on. What are you seeing in Washington that you're getting CBG? I thought it was kind of hard to isolate.
Yeah, I was reading that it is very hard to isolate, but they can get it up to 15% now in some processes. So that's pretty high. I mean, naturally occurring is down 0.01% or something like that. But
yeah, definitely has benefits as for inflammation and possibly tumor regression for some cancers.
So like you were saying, there's a lot more to come with all understanding all of this. Yeah. Thank you very much for what you're doing.
Oh, you're welcome.
Yeah.
You're muted.
Oh, I didn't have any other questions.
I'm sorry. She's muted.
Oh.
You're still muted. We can't hear you. There you are.
I'm muted. That's what you were saying. So sorry about that. So were there any other questions that attendees wanted to submit at this time? If anyone's having difficulty doing that through their Q&A button, they can do that through raising their hand and we can unmute your microphone. These have been some great questions here tonight.
Definitely.
Okay, Victoria, I think we'll give it just a couple more minutes to see if anybody has any additional questions. Was there anything else that you'd like to add?
I guess the only thing I want to add is that I really feel strongly that medical professionals learn more about how cannabis can be used in these settings, that it helped me out tremendously when I was going through my cancer treatment, and that it changed the course of how I look at medicine. And I look forward to meeting other healthcare professionals who are want to learn more about it, that are open to learning about how it can be used and understanding it better, and that we need people to look at it as medicine and not just as something that people use to get a high. And it's just going to take tons of education and saying the same thing over and over again, but it definitely has a place in modern medicine. And I hope that people would be open to it.
So we did have another question come in, and that is, have you worked with or have you heard of people benefiting who are dealing with sarcoma?
I have not, but I know that's the other thing I guess I should say is that I have some connection to a group of integrative oncologists that if I'm not familiar with a specific cancer, if I see that I can't do anything more for someone, that I will be able to connect you with a group of oncology nurses that know way more about cancers than I do. And if somebody got a hold of me and said that was going on and I couldn't help them, I would be like, okay, I'm gonna give you back your money, but I'll also give you some information on some other sources for you to look into. But I do have a research assistant that when something like that comes up, I'll have her do a preliminary search and just see what data is out there and see if I can't put something together. And just depending on what we find, you know, we take it to the next step. But it's really hard. There's so many different types of cancers, And I just know that cannabis at some point is going to be used for its anti-tumor benefits, but it's going to be understanding how to put all of these ratios together for each cancer. It's going to be a while.
Thank you for that. So Victoria is, as you've seen here tonight, she has a wealth of information to share. And I want to make sure that we are respectful of time. We scheduled this to go until 8 o'clock. We certainly don't have to use that entire time, but I do want to make sure that if anyone has questions, that they have the opportunity to ask those. So while we're waiting to see if there are any more questions to get answered, I want to share a little bit of information about Oregon Cancer Foundation. We did not do that back at the beginning of the webinar because we were running a little bit over time to get started. But my name is Amy Johnston, and I am the Executive Director of the Oregon Cancer Foundation. And we are a small nonprofit organization here in Eugene, Oregon. Despite our name, we actually only serve Lane County patients for the most part. But when we have events like this that are educational classes and webinars, we certainly open them up to anybody who would like to attend. So we are here in Eugene. We're in the Oakway Shopping Center, if you're familiar with that. And we encourage you, our office is currently only available by appointment, but we encourage you to visit us online at OregonCancerFoundation.org. And if you would like to make an appointment to come in, we offer financial assistance to Lane County residents. We also have a wonderful breast cancer resource coordinator, as an outreach coordinator who can help with identifying other resources in the community that might be beneficial. We have a number of educational classes and support groups that we offer on an ongoing basis. So again, that website is OregonCancerFoundation.org. And Victoria's website, as a reminder for everyone, is SAGE, S-A-G-E, life, L-I-F-E, .care, C-A-R-E. All right. So we did have another question come in. Yes, Victoria.
I was going to say, if anybody has a question that they think about, they can go on my website and there's an email there and they can send me a question that way too.
Perfect. And if anybody sends questions to us, we will of course pass those on to you. So the question that came in, this is a good one, says, if we are just winging it using cannabis products because we have not been able to get support with it, can we actually do harm?
If you do the dosing strategies that I mentioned, if you start super low, if you find a good product that enables you to start really low, I don't see any harm. The harm is in higher doses with possibly a drug interaction. And when I say higher doses, I mean like CBD, like 40 milligrams or higher CBD, THC, anything above, 5 or 10 milligrams, you might have some drug interactions. So, just ask people to do their research and make sure that what they're using, that there's not going to be a drug interaction, keeping their cannabis, maybe dosing it 2 hours away from any of their other medicines, being sure that they're not going to be driving or operating heavy machinery, just in case they end up getting some sort of psychoactive side effect, that type of thing. If you just treat it like you would any other medicine that you've never taken before, you just don't know how it's going to react. Just, be cautious. I just don't think, the toxicity of THC happens at high doses. When people eat edibles take a long time to work. Anytime you're consuming something like a cookie, it's going through your stomach, it's taking an hour to work, and then people think, oh, it's not working, and then they overconsume. That is the biggest risk for an adult, is getting cannabis toxicity from an edible. So just be mindful that it might take an hour, maybe 2 hours, depending on what dosage form you're using, and be patient with it.
And I would also like to add to that question that if you are actively undergoing cancer treatment or treatment for any disease, please consult with your oncologist and your physicians before using cannabis or any other product that you're trying to use in a medical medicine format. Please, please, please make sure that you are communicating with your oncologist. Make sure that they know.
So important.
Yep. Okay. I actually don't really understand this question, so we may need to get a little bit of clarity. Oh, okay. I'm sorry. There were two questions that came in right back to back. So the first one is, what is cannabis toxicity and how do you know if you have it?
So cannabis toxicity is when you basically take too much cannabis, and it happens a lot when people go into a dispensary and they eat a whole cookie, not realizing that there was like, you're supposed to cut it in half, or, you know, they eat too much of this stuff and they don't realize what they're taking. So what happens in an adult would be racing heart, some anxiety, and that's a side effect of cannabis for someone that's overconsumed, taken too much of it. For a child, it's quite different. For a child, so if a kid gets into the mom and dad's brownies, it's going to be more lethargic, you know, falling asleep. It's going to be quite the opposite. When somebody says, when do I call for help? I mean, you would know, because you would be feeling it bad enough that you'd want to go to the emergency room. It doesn't happen very often, except when people are brand new to it and don't understand the dosing. And that's why I can't stress enough that you need to know what dose you're taking and be patient and, you know, ask the right questions, go to the good dispensaries that are going to guide you to the good products that are going to be well marked, well dosed. And if they say, take half a cookie, just take half of a half. I mean, I always err on the most conservative side. Poison Control Center, you know, I say keep that number handy anyway, because you should have it. People are using cannabis more often and experimenting more, and these things sometimes happen.
Thank you for that. Okay, so we have about 10 more minutes scheduled, so we're going to do a last call for questions at this time. So if there are any final questions, if you'd like to raise your hand or put those in the Q&A, we will get to those before we wrap this up for the evening. We really appreciate, again, everybody taking the time to join us this evening. Again, we hope you're all doing well. We are recording this session. We will make it available, so we will work with Victoria. We know some of the individuals who are attending tonight came through here through your office, so we'll make sure that everyone has access to that and get that distributed. I know that, excuse me, there has been so much going on here in Eugene and in Oregon since we opened up registration for this webinar, and I do think there are a lot of people who were anticipating attending who were not able to. So whether they watch it recorded or maybe at some point in the not too distant future, perhaps we can do another session. You know, this is something that we get asked about a lot, and I know that Victoria does as well. So, all right. Do we have any final questions? We're gonna give it one more minute here. All right, Victoria, I think this has been a wonderful session this evening. Thank you so much.
Thank you so much for inviting me.
Absolutely. All right. It doesn't look like we have any additional questions coming through at this time. So just to wrap up, again, if you're interested in more information about Victoria and her work, you can visit her website at sagelife.care. If you're interested in more information about the Oregon Cancer Foundation and any upcoming classes or events that we have coming up, visit us online at OregonCancerFoundation.org. All right, thank you everyone for joining us here this evening. At this time, we're going to stop the recording and say good night. Thank you.